Hi, my name is Manesh Patel, and I'm from Duke University, and this is the Heart.org booth. I'm at the American Heart Association Scientific Sessions in 2011. With me, I have the pleasure of talking to Dr. Mohler about the CLEVER study. Thanks for joining us.
My pleasure.
Can you tell us what the background was to the study design and what you were planning when you started the study?
Sure. CLEVER, or claudication exercise versus endoluminal revascularization study, looked at three populations of patients. The first was a usual care group where patients got background therapy with Plato, and by the way, the other two groups did as well. The other groups were exercise rehabilitation that was supervised 3 times a week, and the last group was a group that received iliac stenting.
Fantastic. So a very fundamental question in how we manage our patients with claudication.
Absolutely.
And tell us what you found.
Well, the results were interesting. We did find that both the exercise supervised rehab group and the iliac stenting group improved at 6 months, was the primary walking time, on a treadmill. And we also found, interestingly, when we compared the exercise group versus the stent group, the exercise group walked further.
Wow, so just supervised exercise made it better than the stenting group by itself.
At the 6-month outcome.
Yeah.
You are looking at 18 months, but at that point, patients were able to walk on a treadmill further than the group that received the iliac stent.
And did the iliac stenting group also get supervised exercise after stenting?
No, they did not. It was a group alone that did not receive that.
Thanks. So where do you think we go now with this study and the findings? How is this going to inform our guidelines and practice patterns?
Well, I might point out also that the stenting group and the exercise group and the usual care group were compared as far as quality of life.
Yeah.
And those questionnaires actually indicate that both groups, the rehab group, exercise rehab group, and the stenting group, both improved.
Yes.
But what was interesting is, in this particular case, the iliac stenting group had a better improvement in quality of life than direct comparison with the rehab group. So you saw things go two different ways. Again, what happened is that as far as walking on a treadmill, the exercise group walked further, but as far as quality of life, the stenting group actually did a little bit better.
So a bit of a disconnect, at least, into the two sort of usual findings or endpoints we think about for claudication patients: how they feel and how they walk.
Exactly. But I think what it does is provide two viable options for patients. Before, we weren't sure how exercise would stand up to iliac stenting. We knew that both therapies seemed to work alone, but together, head-to-head, and comparing a control group is one of the unique aspects of this study. And we have more information for patients, and I think now they have more choices.
Absolutely. Well, I think landmark science. Thanks for bringing it forward to us today.
My pleasure.